mean, there are certainly other antibody-mediated diseases. There are kidney diseases. There are thrombocytopenia, for instance. There's heart block in patients with SLE. Mothers with SLE have babies sometimes who have heart block. And also there's an increasing feeling that antibodies are important in development. And there may be other antibodies to find in mothers whose children have some kind of developmental abnormality. And indeed, we have done a study which was published now 3 or 4 years ago, in which we found Caspr2 antibodies, a completely different antibody, in mothers who had children with abnormal development. And we were able to show that if you used a mouse model, that those antibodies had long-term effects on brain, not function, because we didn't look at that very closely, but also on brain pathology, suggesting that maternal antibodies to brain proteins can cause long-term effects. So maybe in the future there'll be quite a lot of reasons for using that sort of approach, but that is very futuristic. I think in some respects these are developments from something which started in the 1990s, and I think it's really important for people to go back and look at the literature and begin to realize that there's always something there which needs to be addressed with modern techniques and modern therapies. And that's what we did in this study on the transfer of the antibodies, and using a drug which is now available and for patients with autoimmune diseases is now beginning to be licensed quite widely. So it would not be too much of a stretch of imagination to think that that drug could also be used in mothers whose babies were affected, even if the mother herself was not particularly sick.